Hello, thank you for logging on today to Literacy Volunteers of Harrison County. My name is Dr. Rich Suplita, and in today's YouTube video, we are going to be talking about drug addiction. Okay, so this is obviously a very big problem in the United States. So we want to talk about some characteristics, first of all, of drug addiction. And if you look at the characteristics, drug addiction is characterized by cycles of relapse, and this is, we'll take a look at this, it's driven by obsessive compulsive disorder or OCD-like symptoms. Number two, continued use despite negative life outcomes, and then finally changes in the brain. So we're going to take a couple minutes and look at each of these in turn. So number one, let's talk about the abstinence and relapse cycles. This is very characteristic of any type of an addiction. People will kind of recognize the problem and try to quit the behavior or the drug for a while, only to relapse, and this cycle tends to repeat many, many times. So I mentioned that it's driven by obsessive compulsive-like cycles. What is that? Well, maybe you've heard of OCD or obsessive compulsive disorder. What that means in terms of the psychology is that obsessions are fixated thoughts that overwhelm your attention. And those thoughts tend to produce a high level of anxiety. And the compulsions are the behaviors that are enacted in order to deal with the anxiety. So the obsessions are the thoughts, they create anxiety, then the compulsive behaviors are undertaken in order to reduce the anxiety. Okay? So number two, we'll talk about negative outcomes. Negative outcomes of drug addiction can apply to family life. They can apply to social life in terms of one's friends and acquaintances, in terms of perhaps colleagues at work. Occupationally, obviously, many people lose their jobs because of substance abuse problems. And finally, legal consequences, things like DUI, for example, or perhaps being sentenced to a jail sentence because of purchasing illegal substances. So let's move on over now and we'll talk about changes in the brain. What's going on in the brain when it comes to drug addiction? And so in order to simplify this, I drew kind of a side view of the brain. I put the eyeball on there so you'll know where the front part of the brain is. And so I really want to focus on two major systems in the brain. In green, I have represented something called the limbic system. We talked about that a few weeks ago in the unit on the brain. But the limbic system is the emotional part of the brain. There's a key structure in there called the amygdala. That's a Latin word for almond. The limbic system is in charge of regulating our emotions, both positive and negative. And then in red, I have represented right above the sockets of the eye something called the prefrontal cortex, or the PFC. And the PFC is involved in rational thinking, it's involved in planning, and very importantly for our present discussion, the PFC is important for behavioral inhibition. And what that means is recognizing that I shouldn't do something and then having the resolve to not do that thing. You have to have a very strong signal in your prefrontal cortex to not do the wrong things. And so I've represented before here, and what I've tried to depict is the limbic or emotional system wanting us to do a lot of emotionally charged behaviors, but then a strong tone represented by a big red stop sign there in the prefrontal cortex. And so the prefrontal cortex can provide the inhibition that's appropriate or required not to do wrong behaviors. What happens in the addicted brain is the limbic system becomes stronger because of drug cues, because of changes on the cellular level. The limbic system becomes a lot stronger, and then at the same time, the inhibitory parts of the prefrontal cortex aren't as strong. And so you have a whole lot of go, especially go towards negative behaviors, but a very weak brake system, a very weak inhibitory system that would prevent people from doing those bad behaviors. We want to take a closer look at the dopamine system real quick, because lots of systems in the brain are involved, but the dopamine system really is the one that is most directly implicated really with any type of an addiction. It doesn't even have to be a substance addiction. It can be a gaming addiction or a pornography addiction or something like that. The dopamine system in the brain is very strongly related to what we would call motivation or drive. Okay, it's the drive or the motivation system in the brain. Sometimes you'll hear that dopamine is equated with reward. That's somewhat true, but it's more directly a motivation type of neurotransmitter. And if you think about it, that's really what gets out of whack with addiction. There's too much motivation to do the wrong things, okay? So I've represented here on the cellular level, okay? This is like a very microscopic level of a brain synapse where one brain cell talks to another brain cell. And what I've written here on the left is I've identified that cell as the neuron or the brain cell that is releasing the dopamine. I've represented the dopamine molecules by the little dots in the synapse, right, in the space in between cells, and then I've represented the dopamine receiving neuron. And these little butterfly-like shapes are representing what we call dopamine receptors. So the dopamine is released from the releasing cell or the presynaptic cell. It crosses the synapse and it binds and activates receptors there in the receiving or postsynaptic cell. So in the before state, you'll notice that there's quite a bit of dopamine released, and there's a relatively few number of receptors. Okay, but what happens when a person starts engaging these addictive behaviors over the long term? You'll see that the brain changes. And so I've represented here on the right the addicted state. What you see, most importantly, is that the cell is no longer releasing as much dopamine. The dopamine has been somewhat depleted, okay? And on the postsynaptic cell, the cell has tried to compensate by creating more receptors. And so now you've got this system that is very imbalanced, and it's going to tend to drive the addictive state. Okay, so let's talk a little bit more specifically about those symptoms. Two main ones that we need to talk about are tolerance and withdrawal. Drug tolerance and drug withdrawal. What tolerance means is that the same dose of the drug now produces a lower or a lesser effect. Okay? Consequently, a higher dose is required in order to achieve the same effect. So whatever the drug is, whatever you're using it for, when you have tolerance, you need more of the drug, a higher dose, to achieve the same effect. A person who's using the drug recreationally, either to feel good or to avoid feeling bad, is now going to need a higher dose to do that. Withdrawal will happen when the drug is removed from the body. So when the person attempts abstinence, when they quit taking the drug and the drug wears out of their system, they'll experience negative effects because now you have this imbalanced state. So that's going to be expected while the body readjusts. Now with narcotics or opiates, those are synonymous terms. Opiates are drugs like heroin, methadone, codeine, Lortab, Vicodin. These are all opiates or narcotics drugs. With narcotics withdrawal, we see a heightened state of anxiety and panic, and even to the extent that the person will experience a sense of impending doom, feeling like they're going to die. Chills are very common. In fact, the term cold turkey, maybe you've heard of that before, refers to a person going through narcotics or opiate withdrawal because they'll actually get the goosebumps, right? That's part of the sympathetic nervous system being activated very strongly. Okay, you'll see a lot of nausea and vomiting, and then the person will also experience high levels of pain while the body adjusts. Now, the good news is that withdrawal, if the person doesn't reuse a narcotic, the withdrawal only lasts a few days and then they recover. Okay, we have one last page here. Or 2 pages, okay. So treatment, we'll talk a little bit about treatment real quick. What can you do? Well, this is a big issue, right? Because addiction can very frequently lead to fatal overdose. I was looking at some statistics yesterday, just for the state of West Virginia. 4 times as many people die every year from opiate overdose than die in automobile accidents. And so this is a huge problem even here in the state of West Virginia. One of the problems with opiates is that they tend to be fatal at relatively low doses. They have a low, in terms of pharmacology, therapeutic index. There's not a big difference, in other words, between the dose needed for an effect and the dose needed to produce death, right? And that's not a good thing. So, most people who experience narcotics addiction or opiate addiction do require help quitting. Now, I just want to say, as a person who's been working in this field for about 20 years now, there's no shame in that whatsoever. Okay, if you or a family member or a friend needs to get help, there's no shame in reaching out. 2 major strategies involve inpatient detox, where they'll actually take the patient in for a few days and they'll help monitor them, they'll help them deal with those negative withdrawal effects, and they'll help ensure that their body gets a chance to readjust to not having the substance in their system. And so the other approach, and sometimes these are used in conjunction, is drug replacement with drugs like methadone, or more recently one called buprenorphine, which seeks to stimulate the same receptors, right? So the withdrawal is less, but at the same time, the patient is not put in a situation that might threaten their life, and they can gradually be weaned off of these opiates or narcotics. And before we close, I just wanted to give you a hotline number that you can call if you're interested in more information for yourself or for a friend or family member. The number is 1-877-882-9275. And so, feel free to dial this number and get the important help that you need. Again, my name is Dr. Rich Suplita with the Literacy Volunteers of Harrison County. Thank you for your time today.